Hello everyone, it is February 11th, so tomorrow is Tuesday, the 12th, which will mark 4 weeks post-op, first stage phalloplasty. On Friday, it's the 15th, which will be a month, because I had surgery on January 15th, but tomorrow marks 4 weeks. I am at home, I am pretty mobile at this point. Things are going pretty well. Um, I wrap my arm every day after my shower. It's not a cast, it's just different types of gauze and stuff, and then the bandage wrapped up around. I have pretty well full movement of my hand at this point. Swelling is pretty much completely gone. There's a little bit of swelling in my knuckle here, but for the most part, it's gone. There is numbness. I can't really turn my arm. There's numbness up my thumb. There's numbness where that little bit of swelling is there. There's kind of some painish numbness in my hand on the back there. Little bit of numbness on the thumb area on the palm, but other than that, pretty well completely mobile hand-wise. Wrist-wise, I'm supposed to be kind of stretching it back to see if I can, stretch it back to a normal bending position, which, as you can see, is not, that's as far back as it goes. And I think that the bandage makes it look like it's bending farther than it actually is. But my hand is also kind of like it's leaning this way. It's hard to tell, but it's kind of like resting crooked. So I'm trying to bend it back this way, so that it's, more of a normal straight kind of thing rather than curved upwards. And that's just because of the way it was resting on when I had to keep it elevated on a pillow and whatnot. I guess it just was resting with my wrist kind of bent like that, and now it's just kind of stayed that way. But yeah, the arm is pretty well fine. I don't know if you can see, there's the scar there from where the nerve is taken. The actual arm scar starts about here and goes all the way up to my wrist. There's about a chunk, like a triangle, starting at my wrist going down this way that isn't part of the scar, so it's just regular skin there. But other than that, all the way around is the scar. It is only open to the air when I'm in the shower, and then an hour after my shower, because it has to air dry for an hour, and then I wrap it up and it stays wrapped up for the rest of, the time. As far as wrapping it goes, until all of the scarring, sorry, not scarring, but all of the scabbing and fluids and all that kind of stuff is gone, I'll be wrapping this, which I'm told, depending on the person, 3 months or so. Some people have said 4 months of wrapping it up, and then you go and get the sleeve, the medical sleeve that I'll be wearing for a year after that. But other than that, it's just kind of like, before I couldn't even bend my elbow enough to like reach my face, but I can do that now. I can't extend it completely, like that's as far as I'm getting there. It's really tight all here where the scar is, but again, doing my exercises and trying to stretch it out back to a normal kind of pattern is where we're at this point. My leg, is looking really good. I can't really show you, I'm wearing pants, but nobody really talks about the leg. I guess it's because everything else, like the arm and the phallus, is more important, I guess. But the leg is pretty nasty. During recovery, for the first couple weeks, very painful. When you stand up, it was like a rush of like burning pain. And then after the pain goes away, now it's just extremely itchy. I'm using this vitamin E cream, just from Walmart, on it every day now. There's no bandages on it or anything like that anymore. It's just vitamin E cream every day. But wearing pants, wearing anything on it is really irritating. It's extremely itchy and a little bit painful if it starts scratching like the pants or whatever. So making sure to keep it hydrated is really important. But as far as the leg is going, it looks really good. It just looks really red. It's just two big red triangles, um, or triangles, sorry, rectangles. Um, and it looks like a burn, like it, and it's not that bad. But it just is itchy. Um, as far as the phallus itself, everything is healing. The scabs are starting to kind of come off a bit. I had the catheter and the stitches removed last Tuesday because they stay in for 3 weeks. Um, yeah, so I had the black stitches removed and then the catheter, which hurt a lot. My advice to you is don't try and tough it out. Take the pain meds the day you're getting the catheter removed. I took, they gave me, I think it's Demerol, which is really strong. Um, I took that, which I hadn't taken pain meds since well before, like, I hadn't taken pain meds since like week 1. I think I took pain meds for the first week post op, and then after that, I stopped. Um, the strong pain meds. I haven't taken a pain med since then, and I took the Demerol an hour before I had the catheter removed, and it still really hurt uh, having them pull that out. So definitely take pain meds, even if you're not in any pain, just in general, which I wasn't, which is why I wasn't taking pain meds. Um, I was just told take it an hour before you go, and you'll be grateful for it. And even the stitches, like most of everything on the phallus itself is completely numb. I have no feeling. There are certain parts around it, and then the scrotoplasty area is very sensitive. So the stitches that kind of got closer to that area were very painful when they were taking them out, but everything else was completely numb and there was no feeling, so that was fine. So I'm peeing now. The location of my urethra is, so there's the scrotoplasty, which you know what a scrotum looks like. Basically, kind of like dead center of the scrotum is where my urethra is right now, coming out. So I'm peeing like out of the center of the scrotum, which I don't know if it's swelling from the catheter coming out at this point or it's just the location of where it is, but it makes a mess when I pee, which is really frustrating. I have to sit, obviously. It's not coming out the phallus, so I can't stand to pee yet. That's stage 2. But it kind of like, it drips down because it's kind of coming out like, I don't know how to explain it, but it's coming out going all the way down the scrotum and then up and back under near my anus and just like getting pee everywhere. And then sometimes it shoots up at my thighs, depending on the position I'm sitting in. So basically every time I pee, I have to do a like complete clean of like everything. Baby wipes have been a blessing. When you defecate, you want to use baby wipes for sure as well to make sure you've gotten all of the feces away because you don't want any infection. But even with the peeing, I'm finding I have to go in between like my thigh and the scrotum and then like up and around and wiping everything, to try and get rid of all the urine. I haven't had a ton of problems with leaking urine, except when I wait way too long to go to the bathroom, which I shouldn't be doing. You're supposed to go every 2 to 3 hours. But sometimes I get lazy and I'm laying in bed and then I can, start to feel that I need to get up and go. But I have pretty good bladder control at this point, which I'm grateful for, and I hope that that continues. Yeah, as far as, so the clinic that I went to who removed my catheter and the stitches, there's a hole right at the base of the phallus, underneath. There's a bit of a hole. It's not very big. It's like this big. And it had like all of that gross white crap in it. It's not an infection or anything. It's just a natural healing thing. But the hole opened up and it had all that white stuff in it. And the nurses, when I had sent them a picture, said, air dry, it'll dry and it'll fall out on its own, whatever, it'll be fine. But nothing was happening. Like, it was days and days and days, and it looked to me like it was getting worse rather than getting better. Um, and so, anyway, when I went to the clinic who removed the catheter and everything and the stitches, and they saw the hole, and they were like, "What are you doing to fix that?" And I told them what the nurses had told me, and then they said that I should put this. I actually have it right here. It's called Back to Grass. It's got medication on it, and it's a little dressing that you put on to it. It kind of wets the area and pulls all that stuff out. Because they were saying that all that white stuff that's in the way is preventing that hole from closing, because the white stuff is there and it won't close over that. The white stuff has to come out first before the wound will heal on its own. And so anyway, the Back to Grass pulls all that stuff out so that it will empty the wound out so that it can start closing on its own. So they gave me that, and now I go back every 3 days so they can check on the hole, give me more Back to Grass and dressings and stuff to deal with it. And it is working. Like, it's pulling all that stuff out the way it should be. It's not getting infected down there yet. Hopefully it stays that way. And everything just seems to be progressing nicer, because to me, like, leaving it and not putting anything on it or helping it at all, because of where it's positioned, the phallus is going over it. Even though I was putting it, like, you're supposed to put the phallus to the side and move it around and position it, whatever, I was doing that. However, regardless of whatever position you're putting it in, that hole is being covered by the phallus, because you really have to lift the phallus all the way up to see the hole under there. Just the position of it is constantly covered. And so to me, it was just a bath where infection could spread, because it was impossible to keep it not covered by more skin. So anyway, this Back to Grass stuff seems to be working, and I'm going back to this clinic every 3 days, which is really nice, actually, because then if I have any questions, I have someone to talk to who can actually see in person. Because sending pictures is one thing. Pictures don't show everything. And then waiting a couple days for a response isn't, always the best thing. They're wonderful in Montreal, absolutely wonderful. And I understand they're busy, and that's wonderful. But having someone in person who's looking at it, who is a nurse, who knows what infection looks like, who knows what whatever looks like, and who is looking at it every few days and watching it heal and saying it's doing well and everything looks great, is just more reassuring. Either way, I wouldn't have had to go back every 3 days or anything. I was supposed to just have the stitches and the catheter removed, and that was it. But because of the hole, this clinic is requiring me to go back, and it's their wound care system or whatever. But that's fine with me. It's literally a minute drive up the road from my house, which is excellent. And they're fast. I go in if my appointment's at, it was at 11 o'clock this morning. I went in and I was out in like 5 minutes, because they're just, at this point, they're just looking at the wound, giving me more stuff to help it heal, and then I'm on my way. Not like I'm doing anything else except sitting around the house watching Netflix anyway. So, yeah, so that's what's up with that. As far as emotionally, I'm just bored. At this point, 4 weeks, and my paperwork, my postdoc paperwork and stuff just says, 4 weeks, you're kind of able to start going back to your regular activities. I still have the rest of the month off of work. I'm supposed to go back in March, but yeah, I'm wearing pants, which is excellent, because before I was naked all the time and it was starting to get old. But I can wear pants now, which is really nice. I can sleep with underwear on, which is nice, because I was sleeping naked for 3.5 weeks. And yeah, things are just getting easier, and I'm hoping that things just continue to progress at this point. As far as my daily kind of routine, which this has been the case since I got home, I do a saline spray bath on my all of the incisions on my phallus and scrotoplasty area, um, vaginectomy area, all of that stuff. Any stitches that are genital area, I do a saline bath thing, and then you dry it with the gauze, and inspect all of the surgery sites every day to make sure there's no infection or anything. And I do that in the morning because I do it. You're supposed to do it like opposite of when you shower. I've decided to shower in the evening. It's just easier for me. So I do the saline bath in the morning, showering in the evening. The back to grass stuff is part of my routine now to make sure that the dressing is still underneath there. I do the vitamin E cream on my leg a few times a day, usually right when I get up in the morning, for sure after my shower and before I go to bed. And then if it does dry out, I do it throughout the day. And then the only medication I'm still on is aspirin. I have to take that for 30 days, and I'm about halfway through it, I guess, at this point. So I still have quite a few of those. I take that once a day after breakfast, and that's just to keep the blood clots and stuff from happening. What is happening, though, is I'm getting nosebleeds, which I haven't had nosebleeds since I was a very young kid. So, and it didn't happen often. I've had like 2 or 3 nosebleeds in my life, and in the past couple weeks, I've had like 4 nosebleeds. Not super serious. The first one was more running down my face, but the past few have just been like clearly I'm knocking something, and now there's just kind of blood dripping. But that was not something I'm used to. So I just have to pay attention. I can't blow my nose because it immediately happens. I'm making sure when I sneeze that I'm sneezing out my mouth rather than my nose. But yeah, everything's going pretty well. I'm starting to get back to regular stuff. I'm able to cook myself and everything like that. The weather's been awful with ice and stuff, so I really haven't been going outside because it's just too dangerous. I don't need to fall and hurt myself, so that's unfortunate because I like winter and I really like being outside, but it's just not really safe. So yeah, but days go by pretty quickly, because everything takes pretty long to do. But yeah, it's going really well. I'm a lot more mobile than I thought I would be. I'm doing a lot better. I'm not really in any pain. There's some pain in my arm sometimes, but it's not constant. Just kind of comes and goes. But anyway, thank you for watching. If you have any questions, please let me know. Video topics about phalloplasty, my experience, please let me know. And see ya.